And I was looking at this statistic here that I wanted to share with our viewers. About 700,000 cases of spinal compression fractures occur every year due to osteoporosis. And I believe we have another, here we go, another graphic that kind of gives some points here. Back pain that starts slowly and gets worse with walking, but is not felt when resting. Loss of height as much as 6 inches over time. Goodness gracious. And stooped over posture, or kyphosis, also called, and what's that word there?
Downward hump.
Okay,
So,
thank you for clarifying that. So this is pretty difficult.
Absolutely.
one of the things is that sometimes the first point there that starts slowly, sometimes it can happen like very acutely. So you're all of a sudden you develop back pain and you're from sitting down or not doing any particular strenuous activity. So all of a sudden you develop back problem, and normally we have to have a very low level of suspicion. So normally if the patient has is 80 years old and suddenly all of a sudden they have back pain immediately, that's one of the things that we need to go ahead and start treating, and they should prompt the physician in getting at least an x-ray to look if there's a fracture or so.
Correct. So generally x-rays are diagnostic for these, but in patients who do have a suspicious fracture, we'll oftentimes order an MRI. So that would be more to rule out any underlying tumor or for example, hematoma or bleeding around the spinal cord that could cause difficulties or pains down the legs and things like this.
And I will add a little more thing there. So as well, if you have multiple fracture, you don't know which fracture might be the one that is causing your problem.
It's the most acute.
Because normally we can see people that we're x-raying the patient and all of a sudden we capture a fracture and they don't have any pain. But sometimes we go ahead and order an MRI and we can see that the fractures are old and suddenly there's a new fracture. So we know what's the one that's targeting.
Fracture is.
Exactly where the money is. So we can go ahead and start treating that accordingly.